we want to go in for therapy, and if there is some therapy or intervention that we would like to do, the personality test would give us a lot of information as to what are the various conflicts that an individual is facing, or what are the problems that the individual is facing. So a pre and a post testing would give us a lot of information in case of the progress that the individual has made in terms of therapy. All right. Now, basically, there are two types of personality tests. One are paper pencil tests, and the other is projective techniques. The major paper pencil tests that we commonly see are MMPI or MCMI that are used. There are 16 PF and a number of other paper pencil tests also that are used in clinical practice. Whereas projective technique is a personality test which is designed to let a person respond to ambiguous stimuli, revealing hidden emotions, internal conflicts projected by the person onto the test. So basically, it had the Freudian.
Ma'am, your slide is not visible, I think.
It's not visible.
No, ma'am.
Okay. Just let me do the slide share again. Now?
Yes, now is visible, ma'am.
Now it's visible, right?
Kindly make slide so yes.
Yeah. Now it's visible.
Yes, yes.
Yeah. All right. Like I was telling you all that there are two types of personality tests: paper pencil tests and projective techniques. Paper pencil tests are basically where they are self-report inventories such as MMPI, MCMI, and projective techniques is basically based on the Freudian principles that whatever is there in the unconscious when an unambiguous stimuli is presented, the individual tends to project it onto the test or the cards that are there. All right. There are the most widely used types of paper pencil tests are the MMPI, that is the Minnesota Multiphasic Personality Inventory, and the Million Clinical Multi-Axial Inventory, that is the MCMI. Let's talk about the MMPI. MMPI was developed in 1937 by Stark Hathaway and McKinley at the University of Minnesota. The revised edition of the test was released in 1989 as MMPI-2. The MMPI-2 consists of 567 test items and takes approximately 60 to 90 minutes to complete, and the answer has to be marked as true or false. On the MMPI, there are the various clinical scales. One is hypochondriasis. Hypochondriasis basically tells us where the individual has a lot of complaints about somatic complaints or physical complaints. Depression is where there is depressed mood, hysteria, psychopathic deviate, which is basically antisocial traits that an individual might have. Masculinity, femininity helps us to find out more about if there is any kind of gender identity or gender dysphoria. Paranoia, where the individual may have feelings of suspiciousness, ideas of reference. Psychasthenia is basically worrying excessively, thinking, anxiety. Schizophrenia, where the individual may be withdrawn from reality, not in touch with reality, and may have various other behaviors like, muttering to self and all that. Hypomania, where it's the opposite of depression, where the individual might have a very euphoric kind of a mood. And social introversion, which is basically telling us whether the individual is an introvert or an extrovert. There are these various validity scales that we have. The L scale, which is a lie scale, which tells us about whether the individual is kind of has answered the test title honestly or no. So whether he's trying to project himself in a positive light. The F scale is very often like the patient may mark randomly or may not comprehend the statements, and the K scale tells us about whether the person has been defensive or open while giving the responses. There may be a lot of answers that the patient might not answer, so that is the question scale. Then there is this win, win, FB, FP, FBS scale. These are all validity scales, and if there is an elevation of above 65 on any of the scales, on the validity scales, then the profile might go as invalid, and even if the T scores are above 65 on any one of the clinical scales, we would say that pathology exists. Okay, coming to MCMI, MCMI provides a measure of 24 personality disorders and clinical syndromes for adults undergoing psychological or psychiatric assessments or treatment. So this test is more commonly used if you want to find out if an individual has any kind of personality disorder. So the MCMI is composed of 175 questions which the individual has to answer as true or false. It takes approximately 60 minutes to complete the test. And after the test is scored, it produces 29 scales. 24 are personality and clinical scales, and 5 are scales to verify how the person approached the test. So the test taking attitude of the person. Um, the MCMI scales are divided on the basis of the severity. So moderate personality disorder scales are schizoid, avoidant, depressive, dependent, histrionic, narcissistic, antisocial, aggressive, compulsive, passive aggressive, self-defeating. And the severe pathology scales are schizotypal, borderline, and paranoid. Moderate clinical syndrome scales are anxiety, somatoform, bipolar mania, dysthymia, alcohol dependence, drug dependence, post-traumatic stress disorder. Whereas the severe syndrome scales are thought disorder, major depression, and delusional disorder. So the 5 scales which help us to detect the responses of the test taker, that is the attitude or the validity scale that we talk about, is disclosure, desirability, and debasement. And random response indicators are validity and inconsistency. So if on the MCMI, if the T scores are above 75, then pathology, we would say that there is some kind of pathology which exists. Okay. Coming to the various types of projective techniques, the most commonly used are the RORSCHACH test, the thematic or perception test, children's perception test, house tree person, kinesthetic family drawing test, and draw a person test. So coming to the RORSCHACH test, um, the background to the RORSCHACH test is that it can be traced back to the work of Gehrig. It was Hermann Rorschach who was stimulated by his work, and he initially used the INKBLOT to investigate reflex hallucinations. But gradually he started, using these cards, showing these cards to various people, and he assembled a lot of material for diagnostic purposes. And his book, Psychodiagnostic, was published in 1921, and the Rorschach-Inglot test became available for use at that time. Unfortunately, Hermann Rorschach died at an early age of 37. And had he been alive, I guess the interpretations or what he had in mind for the test and the diagnosis and the interpretation and scoring would have been a little different than what it is now. The Rorschach-Inglot test basically consists of 10 plates. The size of the plates are approximately 17 centimeters, which are printed on hard glossy paper. The ink blots are symmetrical in nature. 5 are achromatic, 2 are black, white, and red, and 3 are polychromatic. This is the first card. Now, this kind of looks like a bat. It is basically black and white, and it's a general motivating plate. This is the second card. It reflects 2 human beings or 2 elephants. This is black, white, and red. and it symbolically represents the female sex. So if there are any conflicts with the female sex, the responses on this card would tell us something more about it. This is the third card, which shows two humans or two women, again being black, white, and red. It's a reality orientation plate, and if there are difficulty in interpersonal relationships, would be reflected on this card. This is the fourth one. It looks like a huge human being or a large furry animal. It's white and black. It is relating to a male authority figure. So if there are any conflicts with a male authority figure or a male figure like a husband, father, boss, colleague, superior, the responses will tell us something more about it. This looks like a bat or a butterfly, and it's again black and white. It's a reality orientation too. This looks like an animal skin. It is light black and white in color. It's again a male sex plate, and if there are conflicts with the male sex, could be reflected on this card. This is the next. It looks like women or dolls, and it's slightly shaded with black and white. It's a mother plate. So if there are conflicts with the mother, the wife, or any other female figure, responses would tell us something more about it. The last three cards are chromatic. So you can see these are much more colored. At the side, you can see like an animal climbing up a tree or an emblem. And this is a reality oriented plate. Here you might see two human beings playing a flute. Again, these are polychromatic. It is dealing with emotional tolerance, and if there is any problems with emotional adjustment, it may be reflected. We always associate colors with emotions, so yes, it does tell us a lot about. Um, Here you could see small, you can see crabs, small insects, animals, and it's a multicolored plate. So here we can also gauge the organizing capacity of an individual and his tolerance to emotional provoking situations. The scoring is done in terms of location, content, and determinants. Okay, location would tell us where the individual can see the response that he gives us. Content is what is the response that he has given, and determinants is why is he seeing whatever he is seeing. So whether it is because of the shape, whether it is because of the color, because of the movement, etc. Okay. Now, the importance of the Rorschach as a personality test, it's ranks as number one test for the use in personality assessment. It is the only test which is objective in the sense that the tester cannot fake the responses, because here the instructions that are given us that he has to tell us whatever he can see on the cards, and there are no right or wrong answers. So there are individual differences, and I mean, every individual can give different responses. So there is no generalization per se. And it's completely a culture-free test. The purpose of the Rorschach test is it is useful for assessments of emotional and intellectual states. We are able to gauge the personality traits of an individual. It is used for psychodiagnostic purposes in a clinical setup. Then identifying areas of conflicts that may be there, strengths and weaknesses of an individual, and planning a treatment program. So if you wish to take up a client for therapy, you can do the testing before the therapy starts, do your intervention, and then post therapy, you can retest, and probably you will see a lot of difference in the responses per se. Okay, coming to the next projective technique is the thematic perception test. This is again a projective technique, and here the subject's responses reveal the underlying motive, concern, and the way they see the world. Here we are able to understand or evaluate the person's patterns of thought, attitudes, and emotional responses to an ambiguous stimuli. The Indian version of the TAT consists of 13 cards on which ambiguous pictures are presented. So this test was developed in the 1930s, by Henry Murray and Christiana Morgan. And the Indian adaptation of this test was done by Uma Chaudhary in 1960. Okay, the rationale behind this test is that people tend to interpret ambiguous situations in accordance with their own past experiences and current motivations, which may be conscious or unconscious, and their defenses would be lowered as they would not realize the sensitive personal information they would be divulging when they are creating a story. So, how do we go about doing the test? We tell the subject that we will be presenting them with us with some cards with a picture on it, and they are asked to tell a story which includes the past, the present, and the future that is there. And the picture or the story should include what has led up to the event that is shown, what is happening at the moment, what are the characters thinking and feeling, what would be the outcome of the story, and we basically have to record the stories verbatim as the patient says it. Okay, this is the first part where you can see a boy is sitting and looking at a Kashira placed in front of him. So you're probably like, there could be stories like revolving around, like, he wishes to learn to play the musical instrument, but he does not have the finances for it. Or you're basically, and then how he would go about kind of maybe he finds somebody who helps him out and learns, and then he probably becomes a musician or something like that. So this basically revolves around how what is the attitude of life that an individual has. Here is the another second card which is showing that there is a country scene where you can see that people are working in the field. So here the focus or the stories would tell us about how an individual functions in a group and how congenial they are, how they get along with each other, and the interactions that are happening uh, within the group per se. Then this is the third part. Here you can see that there is a elderly man and a boy. So it is focusing on the father-son relationship. So if there are any conflicts between the father and the son, or a senior authority figure and a student or something like that, depending on the stories, the interpretation is made. But this is focusing on the father-son relationship. This is the same third part, but it is for the females where we talk about the mother-daughter relationship. Okay. Then this is father-daughter relationship, but the interpretation is done based on the story. So it may not necessarily always be a father-daughter, or like in the previous card, the father-son or mother-daughter. The interpretation and analysis would be based on the stories that are being made. So the figures or the characters of the stories, we would have to see what the story is revolving around which character. And this is again mother-son relationship. Then here you can see that there is this boy who's kind of throttling the woman. So if there is any kind of aggression or violence happening in a relationship, it can be projected on this card. Then this is a card which is showing a very peaceful scenario that is there. It is quite possible that the previous cards may have evoked a lot of emotions in the individual telling us the story. So this kind of a card would kind of little calm him down, or like again interpretation would be based on the stories that are. Here you can see that there is a couple and there is a woman at the window. So it could be again something doing with extramarital relationship, or a paranoid, or very often in the Indian scenario, the rooms may be very small, so the individual may not get the privacy that he or she would um, want. Um, Here it is a continuation of the previous card. It's an additional card. In this figure, we can clear cut see the woman by the window. This is like a vision. So if there are any kind of delusions or something like that, it could be projected on this card. On this card, we can see that there is a woman and there is a jungle, and the woman is probably praying at a temple. Now, again, culturally, if we see a lot of patients coming to us who, believe in the power of religion and spirituality, or sometimes they may also make stories like the individual is possessed or something like that. So, depending again on the stories and what is being projected, the interpretation would be done. This is about a heterosexual relationship. So it could be a couple, it could be an extramarital relationship, whatever. But it is basically focusing on the heterosexual relationship. And the last card is, you can see that it is a dark card and there is some kind of a light. So very often patients might feel very depressed and they feel that there is no hope. There are so many problems and stresses one is experiencing, and hence, like, there is nothing left in life. There could be it could be dealing with depressive features, or it could also be that although everything is so dark, but there is some light at the end. So yeah, and after presenting all these cards, we present a blank card where we tell the patient to imagine that there is something on the card and make a story. So if on all of these cards there is nothing, no conflicts or anything being projected, on the blank card, it is quite likely that if there is something still going on in the individual's mind, it will be projected on the card. Okay. Now, the examiner may ask the subject, you have to, kind of note down the stories verbatim, and like, if there is something that the patient has forgotten to mention or he still wishes to mention, but in between while doing the assessment, it is better not to ask any questions or answer the question about the content of the picture, because very often the patients will say कि आपको क्या लग रहा है, कि इसमें क्या लग रहा है. So then you have to keep telling the patient, no, he has to tell us, and make the story as and how he can. When we are doing the scoring of the TAT, you have to focus on 5 aspects. The hero, that is who is the central character in the story. What are the needs of the hero? Needs are basically, the motives or the drives of the hero. Identifying the pressures is the external factors that are influencing or interfering with the needs. And then what is the theme of the story? What is the story revolving around? So what is the interplay? The various emotions that are being there in the story, or what are the conflicts that are there, whether there are any conflicts, and if the conflicts have been resolved, if there are any defense mechanisms that are being used. All of this one can do the scoring for, and what is the outcome, what is the end of the story, whether the ending was a happy ending or a unhappy ending. Okay, then we look out for what are the main conflicts, whether there are any anxiety and defenses that the individual is displaying in the story, what are the functions of the super ego, and whether there is integration of the ego. Yeah, the interpretation it's very important that we take a case history into consideration when we are doing the interpretation for a TAT or a CAT. The results are very subjective and do not have a formal scoring system. But the analysis of the story will give us an idea of the personality, emotional control, and attitude towards aspects of everyday life. Now, it is quite possible that I have, assessed an individual, and my report findings may be slightly different from another psychologist, because this is a very subjective kind of an interpretation, and it may not be possible that both the interpretations may be the same. Okay, coming to children's perception test, the CAT is a projective personality test which is used for children. There are 2 forms. One form is in the form of animals, that is CAT-A, and the second is CAT-H. That is, there are human figures. This test is used for children from 3 years to 10 years of age. The original CAT cards consisted of 10 cards depicting animal figures in human social settings. Belak later developed CAT Human in 1975, which included humans for children to identify. Okay, this was developed by Belak in 1949, and it is used to assess personality, level of maturity, and often psychological health. The theory is that the child's responses to a series of drawings of animals or humans in familiar situations is likely to reveal significant aspects of a child's personality. Some of these dimensions of personality include level of reality testing judgment, control and regulation of drives, defenses, conflict, level of autonomy, anxiety, fear, and defenses. The method is like the same as in the TAT. The only difference being that with children there are animal figures so that children can relate to it much better and probably would not find it very threatening. But now we do also have CAT humans so that they can relate to the human figures that is there. The subject is asked to tell a story which includes the past, present, and future. So what has led up to the event, what is happening, what are the characters thinking and feeling, outcome of the story. And you have to record the story as the patient, as the client says it. Every word has to be written verbatim. So this is the first card. You can see that, there is a mother, a hen, there is food kept in between, and there are 3 chicks. And in one of the bowls, there is less food. So if there is some kind of sibling rivalry or favoritism happening, it could be projected in the stories that are made on this particular card. This is the second card where you can see that on one side there is an adult and a child, and the other side there is an adult there. So it's basically identification with the parental figure. Now one has to understand that on the CAT very often, like they may just give you a story like the bears are going to the garden and they are playing tug of war. So it's not necessary that every card would have some kind of conflict coming up. This is the third card where you can see that there is a lion and there is a small rat over there in that corner, if you can see. So this is who is the dominating figure that is there. So here again, we have to understand that the stories that are being made are going to help us to understand what is going on in the in the mind of the child. Here you can see that again there is there is a small child that is being taken, and it could be just like they're going out to play, or again if there is any feelings of sibling rivalry where the younger child has a balloon and they are going out for a picnic, but the mother is more closer to the younger one and she's not really concerned whether the other child is following or not. This is where it is dealing with the primal scene. You can see that on the bigger bed there is a couple sleeping, and there are these 2 bears, tiny bears, or in the smaller crib. And here, very often children may be exposed to the primal scene. They may not understand what is happening. So if there is probably strained interpersonal relationship with the parents and the children are exposed to this, they may just assume that there is some physical abuse that is happening and not really understand what is happening. Then here you can see that there is a couple bear in, and there is this small bear which is outside of the cage. So if there is feeling of loneliness, being the only child, feeling of loneliness, where he feels that there is nobody else and I'm alone, and parents are busy with their and they are not paying too much of attention to the child. So it's quite likely that it may be projected on this card. Here there is a tiger and there is a monkey. Here basically it's a kind of the authority figure or the punishing figure that is there. Maybe there has been some mischief that has happened, and the tiger is trying to catch the monkey and try to punish him by eating him up or something like that. So here the authority figure, it can be anybody. is kind of trying to catch the prey, and whether he succeeds or not, again, it depends on the stories that are being made. This is something which we very commonly see in a lot of homes. The parents have a habit of reprimanding the child in front of guests. So if there is something like this happening in the family, you can see that there is a two monkey having tea, and the mother monkey saying something to the child. And the child, most children, I mean, nobody likes to be told something in front of outsiders. So if there is some kind of reprimand that is being um, given to the child at any point in time, it can, and the feelings that the child experiences at this time uh, would could be projected on this time. Then here, this is a room where there is this rabbit who's alone in the house, but the door is open. So again, like you can see that it's quite dark. And again, if there are feelings of depression or anxiety or fearfulness or insecurity that may be there, can be projected on this time. And this is dealing with toilet training. So we know how important the Freudian theory has told us how important toilet training is for the anal phase of development, during the anal phase of development. So if there is any fixation or something like that, it can be kind of projected on that. So here the interpretation is the same as in PAT. You have to identify who the central character is, who is the hero, what are the needs of the hero, what are the environmental factors that are affecting the needs, the interplay between the needs and the presses, and how the story ends, whether it is a happy ending, sad ending, the environment in which the story took place, and the child's perception of the figures in the pictures is also important, because uh, okay, there have been clear-cut things told to us that, okay, this is the father or this is the mother, but who is the child identifying with, that is equally important. Okay, so here again, we are able to find out what are the main conflicts, what are the anxieties and defenses, if any, that are there. Functions of the child, superego, and integration of the child. Again, interpreted in terms with relation to the case history. It is not, it does not have a formal scoring system, and will give us an idea of personality, emotional control, and attitude towards everyday aspects of life. You need to find out what is the main character in the story, what are the needs of the character, what is the relationship of the character to his or her environment. The next is the kinesthetic family drawing test. This is a projective test used to assess child's perception of his immediate family or environment. In 1970, Burns and Kaufman introduced a modification in instructions from draw your family to draw your family doing something. So here the individual, like it is hoped that the addition of movement would help to mobilize the child's feeling uh, with relation to interpersonal relationships. This test can be used for the age group between 5 to 20 years. Uh, the idea of drawing here, so the instruction would be, you give paper, pencil to the child, and you tell it to draw a family doing something. Okay, so the idea of drawing a family doing something gave us a more insight into the perception of the self in a family setup, the interpersonal interaction amongst the family members, and what are the emotional relationships amongst the family members. So the purpose and application of this test is very often when children come to a hospital setup, and especially when they are told that there is some test that they would have to undergo. There could be some kind of apprehension, there could be a fear. Okay, what is going to happen? What are they going to do? Are they going to inject me? Are they going to do something else? So this test can be used as an icebreaker, and which can help you establish rapport with the child, and it is very easy, it's not very threatening, so for the child, that he has to just draw something. Okay, as a technique, this is linked to clinical diagnostic interview, but it tells us more about the dynamics and the actions that are there within the drawing, to a more pervasive psychological issues and concerns. This is a projective technique that helps us to assess personality and attitudes, and it also assesses child's perception of relationships among children, peers, family, and significant others. So this test takes approximately 20 to 40 minutes to administer. Younger children often provide briefer responses, whereas and take less time, whereas older children might give you more information. Okay. Once the drawing is complete, the examiner takes the pencil away and an inquiry is done, where attempts are made at clarifying the child's drawing and investigate their overt and covert processes which affect the production of the drawing. And the examiner might ask the child to identify every human figure which is drawn with a name and age, describe what is happening in the picture and what each figure is doing. Okay, scoring and interpretation, there is a clear-cut scoring booklet, and this helps us to record, categorize, and integrate the child's responses. So there are 5 categories for interpretation. What is the action of and between the figures? What are the figure characteristics? What is the position? What are the distance and the barriers that are there? And the various styles and symbols that are there. So this is an example of one of the child's KFC. So where he has drawn. So depending on, they have, see, he has written the first is the says there is a mom and there is a dad, and then we ask more, okay, what are they doing? What is the mother doing? What are you doing? What is the father doing? So all of this information adds to whatever the drawings are, and we are able to give an analysis and interpretation based on. This is another one that is there, where you can see that there is a family sitting, there is a TV that is there, the person has drawn himself, the mother and the father on the sofa, and there is a brother. And then we question them that what are they doing, what is each individual doing, what are their thoughts, what are they feeling, what are they speaking, and yeah. So the clinical utility of KFD is that if there has been any kind of childhood neglect or trauma, it is depicted on this. If there is sibling rivalry, disturbed interpersonal relationships, harsh parenting, anxiety disorders, externalizing behavior and aggression, childhood onset of schizophrenia. Uh, KFT can also be used to mark the progress in therapy. So very often you can do it before you start therapy. You do make the child do a KFT, take him up for therapy, and then after therapy you can also repeat a KFD, and you'll definitely see a marked difference in the drawings that are there. Very often, deciding in the custody and in psycho legal cases, medical legal cases, this test can be used. The results are interpreted in terms of the case history. The results are, again, do not have a very formal scoring system, but it gives us an analysis of the personality, emotional control, and attitudes towards family life and social settings. Coming to the next, which is the house tree person. This is again a projective personality test, and it requires the individual to draw pictures of a house, a tree, and a person. This test was developed by John Buck in 48 and updated in 69. And this is an adaptation of the good enough test. The test take a response in the form of drawing. Okay. The purpose of this test is to measure aspects of a person's personality, overall neurological functioning of the brain. Buck basically believed that drawings of houses and trees revealed information about an individual's function. So the HTP takes approximately 20 to 40 minutes to administer. The client is given an A4 size blank paper and asked to draw a picture of a house on one, a tree, and a person on each page, and then all the three together on one page without giving any further instructions. Once the drawing is complete, the examiner takes the pencil away, and then they make attempts to clarify the child's drawing and investigate the overt and the covert processes. So the examiner then asks questions provided about for each drawing and note the answer. So like here you can see the house basically represents family relationships. So how they see how you see and interpret your home and family life. It says a lot about how you feel about your family values and generally about your family in particular. The tree symbolizes the deepest and most unconscious aspects of your personality. It generally represents those things that you keep to yourself. A person represents the self-concept that is your ideal self. It shows your attitude towards this world and how your social life and inner world coexist. So you can see that individually first it was drawn, and on this page all the three are drawn together. The results again are done in correlation with the case history. The results are subjective. They, although we do ask a lot of questions on the after the drawing that how old is the house, what are the house's strengths and weaknesses, who all live in the house, how is the environment at home. So all of these questions are also asked which add to or help us in interpreting. Okay, yeah, I think I will end my talk here. So if there are any questions,